What if I told you that right now, sitting wherever you are watching this, your body is quietly losing one specific ability, an ability so small you have probably never thought about it, but so important that researchers have shown it predicts your risk of falling more accurately than your age, your weight, your blood pressure, or even your medical history. I am not saying that to frighten you. I am saying it to wake you up. Because here's the truth that almost nobody is talking about clearly enough. Most adults over the age of 65 do not lose the ability to walk because of an accident, a stroke, or a sudden medical event. They lose it slowly, quietly in their own homes through the gradual weakening of one single movement. And the day they can no longer perform that movement safely is often the day everything else begins to change. The home becomes harder. The stairs become an obstacle. Independence becomes uncertain. The fear of falling moves into the back of the mind and never quite leaves. I am Dr. Samuel Hart. In the next 20 minutes, I am going to teach you the one exercise I believe every single adult over the age of 65 should do every single day. It takes less than 2 minutes. It requires no equipment beyond a sturdy chair. It can be done right next to your kitchen table. And the research on it is some of the most powerful research in all of senior health. By the end of this video, you will know exactly how to perform it, exactly how to progress it over the weeks and months ahead, exactly how to combine it with 2 small supporting movements that quietly amplify everything it does, and exactly how to avoid the 5 most common mistakes I see patients make. Before we begin, do me one quick favor. If you find this video helpful, type the number 1 in the comments below. If you feel I could explain something differently or cover something I missed, type the number 0. I read every single comment, and that simple 1 or 0 tells me exactly what to make next. It takes you 3 seconds, and it genuinely shapes the direction of this channel. When most people decide they want to work on their balance and prevent falls, what do? They stand on one leg. They hold it for 10 or 15 seconds. They wobble. They reach for the counter. They feel good about it and move on with their day. Here is the problem with that approach. Standing perfectly still on one leg does almost nothing to prevent the kind of fall that actually puts older adults in the hospital. Why? Because falls do not happen when you are standing perfectly still. Falls happen in motion. They happen when you are getting up from a chair and your legs cannot quite push hard enough. They happen when you are lowering yourself onto the couch and your strength gives out halfway down. They happen when you turn quickly, reach to the side, or step off an unexpected curb and your body cannot generate the power to catch itself in time. If you want to truly prevent falls, the exercise you practice has to train exactly that. The ability to move your own body weight with controlled power, especially upward and downward, especially through your legs, especially at the moments your body is most likely to fail you. There is one movement that trains that better than any other single exercise. And that movement is the foundation of everything we are about to do. It is called the sit to stand or the chair rise. And here is why it is the single most important exercise for adults over 65. Researchers have spent decades studying which physical tests most accurately predict which older adults will fall, which will lose mobility, which will require a walker, and which will keep their independence into their 80s and beyond. Out of all the tests they have studied, one stands above the rest. It is called the 30-second chair stand test, and it is exactly what it sounds like. How many times can you stand up from a chair and sit back down without using your hands in 30 seconds? The number you can do is one of the strongest single predictors in all of senior health research. Adults who score well on this test are dramatically less likely to fall, more likely to live independently, and more likely to maintain mobility into their 80s and 90s. Adults who score poorly are at significantly elevated risk for the entire downstream cascade of falls, fractures, hospitalizations, and loss of independence. Here is what almost nobody tells you. The exercise that predicts the outcome is the same exercise that improves it. You do not need a gym membership. You do not need weights. You do not need a balance board, a stability ball, or a personal trainer. You need a sturdy chair, 2 minutes a day, and the willingness to do this consistently for the rest of your life. Let me tell you about a patient I will call Eleanor. Eleanor was 78 when she first came to see me. She had stopped going to her granddaughter's school events because she could no longer get out of the auditorium seats without help. She had stopped having lunch at her favorite restaurant because the low booths were impossible to rise from without using her arms. She had begun avoiding any chair without armrests. Her world was shrinking, one piece of furniture at a time. When I tested her on the 30-second chair stand, she could complete only 4 repetitions, all of them using her hands to push off her thighs. 6 weeks later, after performing this exact routine I'm about to teach you, she did 11. By 6 months, she did 17, and she was back in the auditorium seats. Her world expanded again. 2 minutes a day did that. Before we get into how to perform this exercise, please listen carefully, because nothing matters more than your safety. First, if you have been diagnosed with severe osteoporosis, advanced Parkinson's disease, a recent heart condition, vertigo, or any neurological condition that affects your stability, please speak with your doctor or a licensed physical therapist before starting this exercise. The movement is generally safe, but your specific situation may need a modified approach or supervision. Second, if you have had a fall within the last 3 months, especially one that resulted in injury, please get medical clearance before starting a new exercise routine. Your body may still be healing in ways you cannot feel, and pushing too hard too soon can set you back significantly. Third, never do this exercise on a slippery surface or in socks on a hard floor. Wear shoes with non-slip soles, or go barefoot if you have stable balance, and you are on a non-slip surface like a yoga mat or a textured rug. Fourth, always place your chair against a wall so it cannot slide backward as you sit down. Make sure the chair is sturdy, with no wheels, no swivel, and a firm seat that does not sink too far when you sit. A simple kitchen chair, a dining chair, or a hard armchair with the cushions removed is ideal. Avoid soft couches or recliners. They are exactly the kind of seat the exercise is meant to make you better at, not the kind of seat to train in. Fifth, if at any point during the exercise you feel sharp pain in your knees, hips, or lower back, dizziness, lightheadedness, blurry vision, or anything that does not feel right, stop immediately. Do not push through discomfort. Work only within what feels safe for your body, and progress at your own pace, not at the pace any video tells you to. Now let me walk you through exactly how to perform the perfect chair rise. Sit toward the front edge of your chair, not all the way back against the seat back. Your feet should be flat on the floor, about hip width apart, with your heels positioned slightly behind your knees rather than directly underneath them. This foot position is critically important. It loads your weight in exactly the way that makes the stand-up easier on your knees, and far more effective at building the right muscles. Cross your arms over your chest. This removes the temptation to push off your thighs or grab the armrests with your hands. If crossing your arms over your chest feels too challenging at first, that is perfectly fine. We will work through that in a moment. Lean your upper body slightly forward from your hips so your nose moves out over your toes. This shifts your weight onto your feet and engages your legs to do the lifting. The lean is small. It is not a deep bend. It is the same gentle forward motion you would make to whisper across a table. Many of my patients try to lean their whole upper body forward like they are diving, and that is too much. Just nose over toes, that is all. Now press firmly through your heels, squeeze the muscles of your buttocks and the back of your thighs, and stand up. Stand all the way up to a fully tall position with your knees straight but not locked. Pause at the top for 1 full second. Feel the strength in your legs supporting all of your body weight. Notice how the floor feels underneath you when your weight is even on both feet. This pause is more important than it seems. It teaches your nervous system to recognize and stabilize the standing position before you ever attempt to lower yourself back down. Now, slowly lower yourself back down to the chair. Take a full 3 seconds to descend. Do not let yourself drop. Do not collapse onto the seat. Do not let gravity do the work for you. Control the entire downward motion as if you were lowering yourself into a swimming pool 1 inch at a time. The lowering phase is where most of the protective strength is built, and it is the phase almost everyone rushes through. That is 1 repetition. Beautiful. Now here is how to progress this exercise over the weeks and months ahead, because progression is the secret that keeps your body changing rather than plateauing. Level 1, hands assisted. If you cannot yet stand up without using your hands, that is completely fine, and it is exactly where many of my patients begin. Do not feel discouraged. Place your hands lightly on your thighs as you stand. Use only as much pressure as you absolutely need, not more. Over the next 2 to 3 weeks, gradually use your hands less and less. Aim to use them with 1 less ounce of pressure every single day. Eventually, you will find yourself standing up almost without thinking about them. When you can stand 5 times in a row using only the lightest fingertip pressure on your thighs, you are ready for level 2. For most of my patients, this transition takes between 2 and 4 weeks. Level 2, arms crossed. This is the standard version, the one the research test is built around. Arms folded across your chest, no help from your hands, 10 repetitions slow and controlled. This is the level that matches the 30-second chair stand benchmark used by physical therapists across the country. When you can perform 10 consecutive arms crossed chair rises with good form, holding the 1-second pause at the top and the 3-second descent on the way down, you are stronger than the majority of adults of any age. Take a moment to be proud of that. Stay at level 2 for at least 4 weeks before moving on, because the conditioning gains continue building during that period. Level 3, the slow descent. This is where the deep protective strength is built. Stand up at a normal 3-second pace, then take 4 full seconds to lower yourself back down. After 2 weeks, extend to 5 seconds. After another 2 weeks, 6 seconds. The slow descent is what trains the eccentric strength of your legs, which is the type of strength that catches you when you stumble, that keeps your knee from buckling when you step off a curb, that absorbs the impact when your foot lands wrong on an uneven surface. Eccentric strength is what separates older adults who stumble and recover gracefully from older adults who stumble and end up on the floor. It is the most undertrained type of strength in this age group, and the slow descent corrects that with no extra equipment and no extra time. Level 4, the split stance. When the slow descent feels manageable, you are ready to challenge each leg independently. Place 1 foot slightly forward and 1 foot slightly back, about 6 inches of separation. Most of your weight will land on the front leg. Perform the chair rise from this position slowly. Do 5 repetitions, then switch your foot position and perform 5 with the other leg forward. This level uncovers and corrects strength imbalances between your 2 legs, which is one of the most overlooked contributors to falls in older adults. Almost everyone has a weaker leg, and most people have no idea which one it is until they try this. The weaker side will feel noticeably harder. That is exactly the side that needs the most work. That is the complete exercise. 1 movement, 4 progressive levels, 2 minutes a day. There is genuinely nothing more important you can do for the long-term strength and reliability of your legs. But here is the secret that most people miss, and the part that turns this into something genuinely powerful. There are 2 tiny supporting movements that amplify everything the chair rise does for you. I call them potentiators because performing them right before your chair rises measurably improves the quality of every single repetition that follows. Potentiator 1, the toe press. Stand behind your chair with your hands lightly resting on the back for support. Slowly rise up onto the balls of your feet, lifting your heels off the floor. Hold for 1 second at the top. Lower slowly with control. Repeat 10 times. This activates the small muscles of your feet and ankles, which are the muscles responsible for your body's natural reflex to catch itself when you start to tip forward or sideways. Most adults over 65 have lost the connection to these muscles through decades of cushioned shoes and flat indoor surfaces. The toe press wakes those muscles up and reestablishes the neural connection before you ever attempt the chair rise. Patients who do toe presses before their chair rises report better balance during the rise itself, fewer wobbles, and a stronger sense of being grounded. Potentiator 2, the standing weight shift. Still standing behind your chair, hands lightly on the back for support. Slowly shift your full body weight onto your right foot, lifting your left foot just barely off the floor, maybe 1 inch at most. Hold for 2 seconds, feeling all your weight evenly distributed through the right foot. Slowly shift the weight to the left foot, lifting the right foot just barely. Hold for 2 seconds. Do 10 total shifts, alternating sides, 5 per side. This teaches your hips, ankles, and core to communicate with each other in real time. It trains the small adjustments your body makes constantly during walking, turning, and reaching, the adjustments that prevent sideways falls. Almost no one ever practices these adjustments deliberately. 2 minutes of weight shifts performed every day for a month produces dramatic improvements in side-to-side stability. These 2 potentiators take less than 90 seconds combined. Done before your chair rises, they roughly double the effectiveness of the whole routine. I want to pause here for a moment. If even one part of this video has felt like something you can actually do tonight, type the number 1 in the comments below. That single tap pushes this video toward the next person who is sitting at home right now afraid to stand up from their favorite chair. Now let me give you the complete 2-minute daily protocol you can begin tomorrow morning. 10 toe presses, hands on the back of the chair for support. 10 standing weight shifts, 5 on each side. 10 chair rises at whatever level you are currently working at, performed slowly and with control. Then sit and breathe for 30 seconds. That is the entire routine. Less than 2 minutes when you have it down. 2 minutes a day, performed consistently for the rest of your life, may matter more for your long-term independence than almost anything else you could do at home with no equipment and no cost. I want to address the 5 most common mistakes I see patients make because I would rather you avoid them than learn them the hard way. Mistake 1. Rushing the descent. This is the single biggest mistake. People stand up beautifully, then collapse into the chair, missing all of the protective strength that the slow lowering builds. Every repetition should take at least twice as long to lower as it takes to lift. If your stand-up takes 3 seconds, your sit-down should take 6. The descent is not the boring part. The descent is the entire point. Mistake 2. Looking down at the floor. Keep your eyes forward, focused on a point on the wall at eye level. Looking down shifts your weight unpredictably and disconnects you from the environment around you. In real life, your balance system needs to work while your eyes are focused on the world around you, not on your feet. Train this from day 1. Pick a spot on the wall. Stare at it through every repetition. Mistake 3. Leaning too far forward. The lean from your hips should be slight. If you find yourself pitching forward like a diver, your chair is too low or your feet are positioned too far in front of your knees. Adjust your setup before you adjust your form. The lean is nose over toes, not chest to thighs. Mistake 4. Holding your breath. Breathe in as you lower. Breathe out as you stand. Holding your breath causes blood pressure spikes that can leave you lightheaded by the 5th or 6th repetition, especially if you are on blood pressure medication. The wrong breath pattern can also create false muscle tension that makes the exercise harder than it needs to be. Breathe in on the way down. Breathe out on the way up. Once you have it, you will never think about it again. Mistake 5. Skipping the routine on the days you feel strong. I want you to hear this clearly because it is one of the most important things in this entire video. The days you feel strong are the most important days to do this exercise. Every single repetition is building a strength reserve that your body draws on automatically the next time you stumble, miss a step, or shift your weight wrong. The day you feel great and decide to skip is the day you are withholding a deposit from the bank that protects your independence 10 years from now. Do not skip the strong days, especially not those days. The exercise is a savings account. Every single rep is a deposit. There are a few troubleshooting situations I want to address briefly because they come up in nearly every patient conversation I have. If your chair feels too low and the stand-up is genuinely impossible at first, you can place a firm cushion or a folded blanket on the seat to raise it. As your strength improves over the weeks, remove the cushion. Within 4 to 6 weeks, most patients are stronger than they were at any point in the past decade. If your knees ache during the exercise, check 3 things. Are your heels behind your knees, not in front of them? Are you keeping your knees tracking over your toes, not collapsing inward? Are you descending slowly, not dropping? If all 3 are corrected and your knees still ache, stop the exercise and consult your doctor or a physical therapist before continuing. This exercise should never hurt your knees when performed correctly. If you feel lightheaded after the routine, you may be standing up too quickly, holding your breath. Or you may have low blood pressure that drops further when you change positions. Talk to your doctor. There are simple adjustments that often solve this completely. If you cannot complete the routine the first time you try it, that is data, not failure. The number of repetitions you can do today is your starting line. The number you can do 6 weeks from today if you commit to this daily will surprise you. The chair rise builds the foundation, but a complete leg strengthening routine builds the entire structure that protects your independence. The research on this is striking. Adults with weak legs are roughly 3 to 5 times more likely to experience a fall in any given year, compared to adults of the same age with strong legs, 3 to 5 times. That is the largest modifiable risk factor in all of fall prevention research. It is not your age, it is not your medications, it is the strength of your legs, which is something you can change. I have a dedicated video walking through the 4 additional leg exercises every adult over 65 should pair with this chair rise. Every exercise can be done at home, requires no equipment, and is appropriate for complete beginners. That video will appear on the screen at the end of this one. Watch it next. The 2 routines combined take less than 10 minutes a day, and together they form one of the most evidence-supported fall prevention protocols I know of for adults over the age of 65. I want to leave you with something important because the whole purpose of this exercise is not just preventing falls. It is protecting the life you have built. Every chair rise you perform tonight is a deposit toward the ability to stand up from your favorite armchair 5 years from now. Every slow descent you control today is the muscle that keeps your knee from buckling on the staircase in your own home a decade from now. Every set of 10 chair rises you finish this week is part of the reason you will still be living independently, in your own house, on your own terms when so many of your peers are not. This is not about fitness, this is about freedom. It is about the quiet dignity of being able to take care of yourself in the home you have built, surrounded by the people and the objects that make up your life. It is about walking out to your garden whenever you feel like it, climbing into your car without help, picking up your grandchildren when they reach for you, standing in the kitchen long enough to make your own coffee in the morning. None of those things happens without strong legs and a body that trusts itself. 2 minutes a day, one sturdy chair, the willingness to do it consistently. That is the entire prescription. If you have read this far and watched this entire video, you are exactly the kind of person who will actually do this. You are not looking for a shortcut. You are not looking for a miracle. You are looking for something simple, evidence-based, and sustainable, and that is precisely what I have given you today. Now, the only thing standing between you and stronger legs is the next 2 minutes. If this video helped you understand something you had not heard explained quite this way before, please type the number 1 in the comments below. If you feel I could improve something, cover a different angle, or explain something more clearly, please type the number 0. Your feedback genuinely shapes every video I make next, and I read every single one of them. Subscribe to the channel and turn on notifications so you do not miss what is coming next, including the leg strengthening video I just mentioned. Share this video with someone you love who is over 65 and who has started to feel less steady on their feet. There is a very good chance they are quietly scaling back their life because of that uncertainty, and a 2-minute routine like this may be the single most useful gift you give them this entire year. Everything I shared today is educational only. It is not personal medical advice. If you have a history of recent falls, severe arthritis, joint replacement surgery, heart conditions, vertigo, or any condition that affects your balance, please consult your physician or a licensed physical therapist before beginning this routine. I am Dr. Samuel Hart. 2 minutes, one chair. Stop falling for good. I will see you in the next video.